Today we're going to talk about the aging brain. What is considered normal? I mean, we've all had those moments where you can't think of the word or the name is right at the tip of your tongue. When should you be concerned? When should you make that appointment? Let's find out. We've got a doctor just waiting to tell us. I'm Sarah King, and I have a lot of questions. What exactly happens when you orgasm physically? What can we learn from our poop? You gotta get that protein. Get that protein. Ladies, you need the protein. Do you think it's been exaggerated? If I have sex the night before my pap smear, can it mess up my results? In this show, I get to ask all these questions to WakeMed doctors who happen to know everything about everything. Sarah Has Questions is a production of Capital Broadcasting Company and Mix 101.5. It's presented by WakeMed. I have Dr. Michael Soboeiro, which is a name that's Portuguese, I found out. And what is your title? What kind of doctor are you?
I'm a general internist, so I've spent 30 years taking care of people, doing primary care, mostly for older adults, and managing their chronic diseases.
Okay, and one of them is an aging brain.
Correct.
So I'm just going to jump in and ask you, when does the brain begin to age?
Probably soon after childhood. I mean, if you think about it, right? I mean, how easy is it for a 6-year-old to learn language versus a 30-year-old, right?
Right.
And so the brain probably hits its maximum plasticity early on in childhood, really,
Really?
Yeah.
Like, that was my next question. When do we hit our peak? You think it's in our childhood years?
I mean, I don't know the data about this specifically, but I suspect by 18 or so, you've kind of hit your peak,
Wow.
If you think about it, I mean, the human organism, right, is made for a much shorter lifespan than we have now,
That's
right?
true,
I mean, if you think about, having children and things like that, right? I mean, 18 is kind of your physical peak.
Yeah, that's true. Do you think that there are parts, because you mentioned language, so do you think there are parts of the brain that may reach a peak later? Because I could definitely see in childhood there are times when you're like just sucking up language and learning. Is there other things that your brain can get better at as you age?
Yeah, I mean, I think that, I think learning affects the brain, right? We know environment affects the brain. So sure, I mean, there are other things that probably it benefits us to live longer. How about our ability to to process information, to remain calm in difficult situations? That certainly seems to improve as one gets older, right?
Thank God, yeah. Because if I reacted the way I did when I was in my 20s, I'd be much more stressed out. What actually causes our brains to age?
I mean, I think the aging process, which occurs in our entire body, is that, cells get older, right? And they get older, they get dehydrated, they get smaller, and they don't work as well. And again, I think that's not just with the brain. I think what happens with the brain mirrors what happens with the rest of our body.
I heard once that neurons, you don't get any new ones, that you're born with all the neurons you have. Is that true?
I think that's true.
Oh, man.
Again, not my area of expertise, but I think that's true.
Okay. Yeah. Do our brains shrink as we get older? I've also heard these are all myths that I've heard.
No, they do. They do.
do.
I mean, if you look at scans as people get older, there's no question that brains shrink, and brains shrink more when they're under stress. So, and I'm not talking about emotional stress. I'm talking about things like vascular disease, things like blocked arteries.
Okay.
You can actually see in patients that have a severe vascular disease that the brain gets smaller and smaller over time.
Oh my gosh. And I would assume that their cognitive abilities shrink along with it.
No question.
Okay. Well, what's the first thing to go when our brain is in the act of aging?
Well, I think that memory is what people think about it, and memory is typically what goes first. But it's important to differentiate. Yes, as we get older, our memories aren't as great, but that doesn't mean that we're having brain degeneration a disease process, right? That is just what you've said, the aging brain, right?
Yeah.
And we can call them senior moments or whatever. But I mean, again, going back to the childhood example, right? I mean, kids can remember things amazingly when they're 6, 7, 8.
Oh, and then they'll hold them against you. I don't know about your children.
Absolutely.
Yeah.
Right. But even at 30 and 40, you see those differences, right?
Okay. Yeah, that's true. I mean, I know that my memories have gotten much worse, and I know the the perimenopausal brain is a whole nother ball game.
Yeah.
Well, So yeah, we're going to forget stuff. When does it reach a point of concern?
Well, I think that, again, some memory loss is a normal part of aging, right? So what's concerning? I mean, concerning is when that memory loss gets to a point where it's affecting daily function. And that's actually the definition. So let me read the definition of dementia so we know what we're talking about.
Great.
Okay. So the definition of dementia is a decline in cognition involving one or more cognitive domains. And those 6 cognitive domains are learning and memory, language, executive function, complex attention, perceptual motor skills, and social cognition. So in order to be diagnosed with dementia, you've got to have bad enough change in one of those areas to affect your daily functioning and independence. Just having memory loss doesn't do it.
That's
It's
just
got
one
to
of them.
affect your functioning.
Okay, so can you go back through that list? What is the executive function? What is that?
Being able to execute a task, be saying to you, pick up those cards, move them over there, a complex task. That's one of the things we see go as people develop dementia.
What about getting to the gym? Is that an executive function?
Sure.
Because I find that's hard.
Well, getting there, but I mean, being able to go through it A, B, C,
Right,
D
right.
type. Interestingly, in most dementing conditions, it's usually memory that's first, okay, and then you can often see issues with executive function, so being able to carry out tasks. Some of the other cognitive domains tend to be later. Language, for example.
Okay.
As we see people who have dementia progress, they often aren't able to communicate, right? We've seen that, right?
Yeah.
Complex attention, being able to attend to something, paying attention, having a conversation, right? So as people get older, that they lose that. Perceptual motor is often one of the earlier things. We see people who develop dementia, often how they come to medical attention is they have accidents when they drive because their perceptual and motor skills are not quick enough to react to what's in front of them.
Okay, so some people would call that the reaction time.
Sure.
Okay,
absolutely.
gotcha.
Right. And then social cognition, being able to understand a social situation, read body language, understand,
really?
Being able to react in a social situation. Yeah,
Wow, I have to say I haven't been around a lot of people with dementia, so I didn't realize that that's sad, really. It's almost like you're kind of falling apart.
That's what happens with the disease.
Yeah.
Unfortunately.
Well, I would guess people who have dementia, probably aren't the ones making an appointment for themselves.
So that's interesting too. So, people come in all the time and they say, Doc, my memory's going. I'm really worried. And what I say to them is, in 31 years of doing this, I'm not sure I've ever had a patient who came in complaining of their own memory loss who truly had dementia. Patients don't come in with those complaints and have dementia. It's their family members that bring them in.
That makes sense.
So every single time it's the daughter or the son or the brother or the cousin or the friend who's bringing and saying, hey, I'm worried about this person because this happened, because this is how they're acting. So that is typically what you see. And you really can reassure people who just have age-related memory loss to say, hey, this isn't isn't how people present with dementia.
Yeah, well, that's good. That's good. So let's talk about dementia versus Alzheimer's. What is the difference?
So it's not versus, okay?
Okay.
Alzheimer's is a form of dementia.
Okay.
So if we're talking about true dementia now, based on the definition that I just gave you,
right,
60 to 80% of cases of dementia are Alzheimer's disease. 20 to 40% are other causes like vascular dementia, like Lewy body dementia, like frontotemporal dementia, like Parkinson's dementia. But far and away, the biggest cause is Alzheimer's disease.
Okay, so we went over the what do you call it, the vascular one, which is when you don't get enough blood to the brain and it shrinks. And I know you don't need to go through all of them, but I know the Lewy body is been in the, that's what Robin Williams had.
That's right.
So what exactly is that, and how does it happen?
I mean, I'm no expert on Lewy body dementia, but it's basically neurodegeneration of those specific cells.
I gotcha.
Okay, and most of these causes of dementia are neurodegeneration, so degeneration of neurons.
Gotcha.
And they're just different ways that takes place, right? Now, the outlier there is vascular disease. That's not neurodegenerative. What it is it's lack of blood flow that is leading to a loss of cognition. The good part about vascular disease is it's reversible, right?
Oh,
the
good.
others aren't really reversible,
Right.
but vascular disease is. So if you have vascular dementia and you lower blood pressure and you lower cholesterol and you lower blood sugar, you can actually see some improvement here.
Oh, good.
Now, here's the other kicker. Vascular disease complicates dementia in 25 to 50% of people with other causes of dementia.
Which makes sense.
Which makes sense, right? And we have a lot of vascular disease out there, right? Because that's what causes heart attacks and strokes, and that's the main reason that for the demise of most of us in the end, right?
Okay.
But by fixing the vascular disease or by preventing it, you can significantly decrease the chances of getting dementia.
Huh, look at that.
Yeah.
So what makes Alzheimer's, the other ones were neurodegenerative. I've heard things about plaques.
Yeah.
So what is all this?
So, to stay really simple, there are amyloid plaques. Amyloid is a substance, it's a protein. And for whatever reason, people who develop Alzheimer's disease develop these amyloid plaques. And these amyloid plaques get in the way of the neurons communicating with each other.
Interesting.
And that is the neurodegenerative process that occurs.
I see. So what can we do to prevent these types of things happening to us? I mean, can you prevent something like Parkinson's? Isn't that something that's on your genes? Like you're going to get it whether you want to or not? Or
Yeah. I mean, well, when you bring up Parkinson's, I'm not sure that there's a preventive way to do Parkinson's. Although, we know that lifestyle decreases a lot of diseases, right? So not drinking to excess, not smoking, I mean, that decreases a lot of diseases.
Okay.
But let me make a point that's important here about prevention. So for 30 years, patients have been coming in to me and saying, Doc, I want the pill for Alzheimer's. I want the pill for Alzheimer's. And now that there actually are medications for Alzheimer's, you hear that more and more. And somebody heard on the news, there's a new medication for Alzheimer's. Doc, I want that. I want that.
Right.
And here's what I say. So let me talk a little bit about what that medication is and how it works, okay? And I'm just going to look to make sure I get the statistics
check your notes.
right.
I have note cards. It's Alzfair.
So the new medication that's been approved is called Leqembi.
Okay.
And let me tell you about Leqembi. So in clinical trials, patients who took Leqembi had 25% less cognitive decline. So one of the authors of the Leqembi paper said, it takes people declining at 60 miles an hour and slows them to declining at 45 miles an hour. You're still declining, you're just not declining as fast. They calculated that this would keep someone with Alzheimer's out of long-term care for about 6 months.
Oh.
So pretty modest, right?
That is
pretty
modest, yeah.
Okay. It's slowing an already slowly progressive condition. It's probably not a perceptible slowing day to day. Okay? Now, it has a price at probably higher than $100,000 a year when you think about all the things that go into taking this medicine and having scans and all these other things, right? And it can cause some pretty significant side effects. Swelling in the brain, bleeding in the brain.
Oh, my.
So the point I'm trying to make is this is not a panacea.
No.
This is not something we're going to give populations of patients. All right. Now, so that patient who comes in and says, Doc, I want the Alzheimer's pill. What do I tell him? I tell him, I've got a much better treatment for you. There are 159 studies showing lifestyle interventions that prevent dementia. Blood pressure control, Mediterranean diet, adequate sleep, physical activity, social engagement, cognitive training, treatment of hearing loss, smoking cessation, avoidance of binge drinking. All of those things in studies have been proven to decrease the chances of getting dementia. There was a study published by the CDC in 2022, showed 8 important risk factors for cognitive decline.
Okay.
High blood pressure, lack of physical activity, smoking, excessive alcohol use, obesity, diabetes, depression, and hearing loss. If you had none of these, the prevalence of cognitive decline was 3.9%. If you had 4 or more, 25%.
Wow, so this is a much better result.
That's what you can do, right?
Yeah.
It's not about what pills out there. It's about taking care of yourself and doing that early on to prevent dementia.
But we live in America and we love some pills. And I know, well, and also like we've spoken before that our healthcare system's kind of built up to fix as opposed to prevent.
Right.
So it's good to hear this. And
this is an example where it's so clear. I mean, there just isn't any pill, right?
Yeah.
There just isn't. And people have studied all kinds of things, and they've studied vitamins, they've studied statins, they've studied anti-inflammatories. There just hasn't been any good data. This is where the data is.
Right. What I'm really interested in is the treatment of hearing loss. That's unexpected.
I mean, if you can't hear and you can't interact with your environment, you lose the connection to that environment much more quickly, and it really contributes to that. I think going downhill in terms of your ability to interact, your ability to talk and to affect your environment.
So it kind of goes hand in hand with social engagement.
Absolutely.
Without the hearing, you're going to have less social engagement, and then the cognitive training. So doing the crossword puzzle every day is good for you.
Absolutely.
Yeah.
Keeping your brain active. I mean, there's a zillion ways to do that. Social interaction, really important. I mean, it's not just doing the crossword. It's getting together with your friends, doing things, doing activities. Really important.
This is a listener question.
Yeah.
Why are old people so grumpy or, oppositely, overly nice? Is this a symptom of an aging brain?
I honestly don't know the answer to that question. But let me segue it to another part. Okay. There's a huge incidence of depression as people get older, right?
It makes sense.
They have fewer social connections. They may, feel bad that their bodies won't do what they used to do, or their brains won't do what they used to do, right? And so there's a huge incidence of depression. And what we call depression that sometimes masquerades as dementia we call it pseudo dementia. So sometimes you'll have an older person come in and they'll be brought in by a family member and they say, mom's not talking, she's not interacting, her memory's poor, I think she has dementia. And one thing you can do is you can give them a trial of therapy for depression. And you'd be amazed that a significant percentage of people will perk up and not have any dementing characteristics or have many fewer dementing characteristics once you treat the depression. So I would relate the grumpiness maybe to more of that. Yeah.
Who asks for cognitive assessments more often, men or women?
Women get more health care. Women try to obtain more health care than men do. Men are usually more...
As a man, why do you think that is? As a woman, I can tell you, we're very complicated creatures.
Well, I think women are sometimes more tuned in, tuned into their bodies, tuned into their environments, and men are like, whatever,
I'll get through it. I'll take the trash out.
Right. So I would suspect it's more women. I think... I certainly have seen the case more often that a woman brings in her husband and says, I want him tested for this, that, or the other thing, than vice versa.
Yeah,
right?
I mean, it makes sense because she's also tuned into her family. Yeah. All right. Well, menopause and mental fog and forgetfulness. Is it really perimenopause or is it just a sign of aging? Is there really a way to tell?
I think it's hard to tease that apart. I mean, I do think that estrogen is important. It certainly has a function. And when a woman stops producing estrogen, there are a lot of changes that occur. Oh, dear God, I know. Right? And again, just going back to the whole model of, what our body, our organisms were made for, right? I mean, people, only recently have started living to the point where a woman is living without estrogen for many years, right? And so we've struggled with, do we replace that? How do we replace that safely? And it's still a struggle, but there's no question in my mind that losing estrogen, especially losing it very quickly, can affect the brain as well as other parts of the body.
Yeah, we've done numerous podcasts on different stages of perimenopause and menopause, and it blows my mind that estrogen is in every part of our body. So I don't know why it's so confusing that once it's gone, it's going to affect whatever part of the body it was in.
Absolutely.
All right. Can mental illness make your brain age prematurely?
I don't specifically know a study based on that.
Okay.
But I believe that, both genetics and physiology and environment affect everything.
Right.
And I think they certainly affect the brain. So I think if somebody is having brain dysfunction that is mental illness, that it can also affect their memory, their long-term learning, their executive function, all of those things. So I would say yes.
Yeah. How about trauma?
No question. I mean,
Oh, really?
Well, brain trauma or
Emotional trauma.
No, absolutely emotional trauma. There's a lot of those studies done in children. Do you know what ACEs are? Adverse childhood experiences. And they show that, children who have multiple adverse childhood experiences have significant issues later in life because of those experiences, because of that trauma, both in their cognition and and the propensity to get mental illness and the propensity to get physical illness.
Oh, there's so much. Got to take care of your babies. It's so sad, though, because some things are unavoidable, All right, last question. What can be done to keep the brain agile, and can we get back anything we've lost? That's the last question.
So, I think if you're talking about can we get back neurons, the answer is no, right?
Right.
But, can we preserve what we have? Absolutely. Can we treat the things that are treatable? Meaning, can we, treat depression, lower blood pressure? And I want to make the point, it's interesting about blood pressure as compared to the other factors we talked about. Not only does blood pressure prevent the vascular disease, but it seems to lower the incidence of things like Alzheimer's disease. So controlling blood pressure is important, not just for its vascular outcomes, but for other outcomes.
That is a very compelling correlation.
It is.
Yeah.
It is. But so I think we can get what we have to function as maximally as possible by controlling risk factors, by taking care of ourselves. We can't get back what we lost, but we can make the rest of it function at peak efficiency.
I like it. Okay, so control your blood pressure, eat a Mediterranean diet, get lots of sleep. As a morning show host, I'm trying, man. I'm trying. Daily physical activity. Get engaged with your friends and your family. Do puzzles and read and learn languages and play the piano. Treat your hearing loss and avoid binge drinking and heavy smoking. All right.
Smoking at all.
Okay, so thank you for your time today.
My pleasure.
I love a doctor who's super well researched. And for those of us who overthink everything medical in our life, aka hypochondriacs, if you think you have so much memory loss that you might need to go see a doctor for dementia, we just learned that you're probably not the one who's going to be taking you in, so rest easy. Dr. Michael Soboeiro is a primary care physician with WakeMed, and you can find him at wakemed.org. Let us know what you thought of this episode or send ideas for future episodes to WRALFM.com/Sarah Has Questions. Thanks for listening and watching. We'll see you next time.